Hello students. So today we will discuss the last part of the sphenoid bone, that is the fourth session. Now in today's session I will discuss two important remaining part of the bone. One is the pterygoid processes and second is the lesser wing of the sphenoid. So let's discuss the lesser wing of the sphenoid first. Now when you will see the lesser wing, you know that it is a triangular bony plate. Now where is this triangle is present? Now when you will see the sphenoid bone, this is the triangular bony plate which is present here. Now this triangular bony plate is having a tip, it is having the two roots, it is having two surfaces and two borders. So that we will discuss one by one what are the important features in the different part of the lesser wing. So here you can see that this is known as tip of the lesser wing of the sphenoid. This is the tip of the lesser wing of the sphenoid, which is the lateral ends of the bone. Now when you will see the root and surfaces and the borders, here you can see that these are the two roots, one is this and one is this. Now these roots are basically the two different boundaries of optic canal. So here you can see this is the lateral boundary of optic canal, this is the medial boundary of optic canal, and these are actually connecting this plate with the body of sphenoid. They are known as roots of the lesser wing which are enclosing the optic canal. Then you will have the two surfaces, this is the superior surface, then you will have the inferior surface. You will have the two borders, one border is this which is the anterior border and this is the posterior border of the lesser wing of sphenoid. So let's discuss first about the optic canal. So what is optic canal? It is the area which is enclosed within the roots of your lesser wing, and there are two very important contents in this canal. One is the optic nerve itself and second thing is ophthalmic artery. So in this image you can see that this yellow color, these are the optic nerves which are going into the respective optic canals and they are having the arteries which is ophthalmic artery. So this is a question for your exam, contents of optic canal. Then we will move to the borders of the lesser wing. So first we will talk about the anterior border. Now here in this image you can see that this is the anterior border. Now this anterior border is making joint with this orbital plate of frontal bone. So in the fully ossified skull you will not find this, and this is what actually, if you will see, this hole is the floor of anterior cranial fossa. So this line, or you can say this joint between the orbital plate and the anterior margin of lesser wing is a component of floor of anterior cranial fossa. Now what about the posterior border? Now this posterior border is free and it is a important anatomical landmark between the anterior and middle cranial fossa. So this cranial cavity divided into the three part, anterior, middle and posterior cranial fossa. Now this is the posterior margin of lesser wing which is a line of demarcation between the anterior and middle cranial fossa. Clear? Now this is a free border and along this border you will find a sinus which is known as sphenoparietal dural venous sinus. So here you can see this is a blue line is visible along with the posterior margin, and this is actually the sinus, and what is the name of this sinus? Sphenoparietal sinus. Now there is a one more important thing is that this is the middle cranial fossa. So which lobe lies in the middle cranial fossa? Answer is temporal lobe. And you know that whenever we are talking about the brain, this is the temporal lobe, this is the frontal lobe, and between the temporal and frontal lobe here you will have this space which is known as lateral sulcus. So this lateral sulcus occupies this free margin of your lesser wing of sphenoid. Now apart from that, what will happen that this lesser wing will give a projection in the midline, and this projections medially are known as anterior clinoid process. So you will have one projection on right side, one projection on left side, and these projections of the lesser wing are known as anterior clinoid processes. Clear? Now in this image you can see that this is your frontal lobe, this is temporal lobe. Between these two lobes there is a space, and this is the sulcus. Now this is the lateral sulcus. So when you will place this inside the cranial cavity, this area occupied by frontal, this area occupied by temporal, and this sulcus will occupy the margin, so that this anterior end of temporal lobe will accommodate inside this middle fossa. Clear? Now, what is the importance of anterior clinoid process? So anterior clinoid process is having the three important relations. First is that it provides free margin to tentorium cerebelli. Now what is tentorium cerebelli? It is a fold of dura mater which is present in the posterior cranial fossa, but the tentorium is having the two margin, attached and free margin. The anterior end of free margin is going to attached here on the anterior clinoid process. Now apart from that, here you will have the carotidoclinoid ligament, which we have already discussed in my previous session of the sphenoid bone. Then there is a interclinoid ligament. So what do you mean by interclinoid ligament? Connected from posterior clinoid process. So this is the posterior clinoid process, this is the anterior clinoid process. So between them you will have interclinoid ligament. Clear? Now, so there are three attachment. One is anterior end of the free margin of tentorium cerebelli, second is carotidoclinoid ligament, and third is interclinoid ligament. So how this tentorium is attached, that we will see in this video clip. Now here you can see these are the three different component: sphenoid bone, this is occipital bone, and these are the right and left tentorium cerebelli. Now you can see that this is the anterior margin which is having attachment on the anterior clinoid process, and apart from that there is a interclinoid ligament also which is connecting this posterior clinoid process to the anterior clinoid process. So this is how your anterior clinoid process provide attachment to the anterior free margin of tentorium cerebelli. Now we will move to the superior surface of the lesser wing. Now when you will see the superior surface, I told you that this free margin demarcate the posterior border of anterior cranial fossa. So this whole superior surface along with the orbital plate and the lesser wing become the part of anterior cranial fossa. So here they are related with the inferior surface of cerebral cortex. Now we will move to the inferior surface. Now inferior surface is important because when you will see the inferior surface, it is visible through the bony orbit. So when you will see the bony orbit, when you will look inside the orbit, you will find that lesser wing is contributing into the roof. Now where in the roof? In posterior part of the roof. Now see, this is your orbit. This is the near the apex, that means near the posterior part of the orbit. Now in this area, we have already discussed in the last class that there is a attachment of the ring of Zinn, and one of the tendinous ring attached on this projection on the inferior margin of greater wing of sphenoid, and this is the lesser wing. Now in this lesser wing you will have the optic canal. So this is the optic canal, and around this canal you can see that this is the part of the ring which is attached here. So what is the attachment or what are the structure on the inferior surface of the lesser wing? So answer is it provide attachment to the tendinous ring just above and medial to optic canal. So this is optic canal, so just above and medial to optic canal you will have this much portion of the ring. Clear? Now apart from that, the remaining surface is also providing the origin of two muscles which are here. Now this is levator palpebri superioris and more medially superior oblique. So these are the two muscles which are also arising from the surface of lesser wing of sphenoid. So inferior surface of lesser wing give origin to the two muscles. So here you can see, now you can make this clear visible here, the lesser wing. So this is the lesser wing. Now this is the optic canal. So whenever you will have the optic canal, you should keep this thing in mind that we are dealing with the lesser wing. Now in this structure you will have the attachment of the ring like this. Now this is the attachment of the ring. Clear? Now this part attached on this tubercle, and here it is attached on the inferior surface of the lesser wing like this. Clear? So now you are able to understand. Now in this video clip you can see that this is the ring of Zinn which is enclosing the optic canal also, and along with this ring, you can see that this inferior surface is providing origin to these two muscles. One is levator palpebrae superioris and more medially this is the superior oblique muscle. Clear? Now we will move to the next part is the pterygoid process. Now dear students, when you will see the pterygoid process, these are the vertical projections and they are downward descending vertical projections which are coming from the junction of the body of sphenoid with the greater wing of sphenoid. So when you will see this diagram, in this diagram you will make out that this is the body. What is that? This is the body and this is the greater wing of sphenoid. This is the greater wing of sphenoid. Now at the junction of these two, you are able to see these two projections which are known as pterygoid processes. So pterygoid processes are the paired process. Now each process consists of two plates, lateral and medial plate. So here you can see this, these are the two lateral plate and inner side these are two medial plates. Clear? Now these plates unite anteriorly. Clear? But dear students, you have to understand that the fusion of these two plates is not complete in full length. Now here you can see that this is the length of the plate, but they are united only into the upper part, not into this lower part where you are able to see this gap. Clear? So this is an important thing to understand, that the plates unite in upper part but not in the lower part, and this is the anterior view. So when you will rotate the sphenoid and see from the posterior side, this anterior fusion create a gap on the posterior side, or you can say a kind of fossa, and that is known as pterygoid fossa. So this is the posterior view where you will find a depression inside the pterygoid process. So this pterygoid process depression, which is seen behind this fused part of the upper area of pterygoid plates, is known as pterygoid fossa. Now anterior surface of the fused pterygoid process is going to make a posterior boundary of pterygopalatine fossa. Now here what will happen, that when you will have the articulation with the palatine bone, so the palatine bone is having a articulation like this. Now when the articulation is there, this perpendicular plate is going to articulate here and this is going to form the posterior boundary of pterygopalatine fossa by the pterygoid processes. So that is the one thing. Now second thing is that this ununited, now see, this ununited lower portion is known as fissure. This is known as fissure. Now what is the name of this fissure? This fissure is known as pterygoid fissure. So lower ununited is known as pterygoid fissure. So there are two plates. These two plates will fuse in the upper part, and behind that fused part you will have depression is known as pterygoid fossa, and between the two unfused plate you will have a gap is known as pterygoid fissure. Now the pterygoid fissure is basically the area which is going to make a joint with the pyramidal process of palatine bone. Clear? So when you will have this bone which is known as palatine bone, now this palatine bone is having a process. Now this process which is making a joint here is known as, this is known as pyramidal process. So what is the area or what is the part of the palatine bone accommodate into the fissure? Answer is pyramidal process of palatine bone. So in this video clip you can very well see that these are your two palatine bones. So this is the anterior view you are seeing, and when you will separate all these three bones, you can see that this is a fused part of the pterygoid plates, and these are the three foramina which we have in the pterygopalatine fossa. This is foramen rotundum. This is our anterior opening of pterygoid canal, and when there is articulation will occur, we will have one more canal that is known as palatino-vaginal canals, that we will discuss in the coming slide. So that is the important thing, is that this area, what is that? This area is known as pterygopalatine fossa, and this pterygopalatine fossa posteriorly is limited by this fused upper part of the pterygoid processes plates. In this pterygopalatine fossa, if you will see, there are 3 openings are present from lateral to medial side, foramen rotundum, then anterior end of your canal is known as pterygoid canal, and one more small opening is visible, which is known as palatino-vaginal canal. Clear? Now, we will move to the lateral pterygoid plate. Now, in this lateral pterygoid plate, you will find that this plate is having the 2 surfaces, it is having the 2 borders. Now, what are the 2 surfaces of the lateral plate? Now, this is the lateral plate, it is having the lateral surface and it is having the medial surface. Now, it is having the 2 borders. Now, this is the anterior surface, so this will become anterior border, and this is the posterior view, so this will become the posterior border of the lateral pterygoid plate. Clear? Now, we will see both the surfaces of the lateral plate. So, first is the lateral surface of lateral pterygoid plate. Now, this is the lateral surface of lateral pterygoid plate, and this lateral surface of lateral pterygoid plate become the one of the boundary of infratemporal fossa, because this is the area which is known as infratemporal fossa. This is infratemporal surface of the greater wing, and this is continue with this lateral surface. Now, this infratemporal boundary, which boundary? Medial boundary. So, it contributes into the medial wall of the infratemporal fossa, and this area will give rise to the one muscle, and that muscle is known as lateral pterygoid muscle. Now, there are 2 heads of the lateral pterygoid. One is the upper head that comes from this infratemporal crest, and one is the lower head, and this lower head is coming from this lateral surface of lateral plate. Now, when we move to the medial surface of lateral plate, this medial surface of lateral plate is going to form the lateral wall of pterygoid fossa. So, I just told you what is pterygoid fossa. Pterygoid fossa is nothing but it is a space between the lateral and medial pterygoid plate. So, this plate is but obviously on the lateral side of the fossa. Now, the inner surface of this plate is for the origin of deep head of the medial pterygoid muscle. Clear? So, medial pterygoid is also having 2 heads. One head is coming from the maxillary tuberosity and one head is coming from this medial surface of lateral pterygoid plate. So, lateral pterygoid plate laterally related with the lateral pterygoid muscle, and lateral pterygoid plate medially related with the medial pterygoid muscle. So, here in this video clip, you can see the same thing, that for the proper exposure of the infratemporal, we have to remove the mandible. So, once you will remove the mandible, you can see the whole infratemporal fossa, which is anteriorly bound by the posterior wall of the maxilla, and on the superior part you will have the greater wing of sphenoid, and on the medial side here you can see your lateral pterygoid plate. Now, this lateral pterygoid plate is for the lower head of lateral pterygoid muscle, which is going back to insert into the head of mandible in pterygoid fovea. Now, this is the medial pterygoid. Now, here you can see that medial pterygoid coming from this medial surface of lateral plate, and it is going to insert on the inner side of the angle of mandible. Now, we will move to the borders of the lateral pterygoid. I told you there are 2 borders of this plate, anterior border and posterior border. Now, this anterior border form the posterior boundary of pterygomaxillary fissure. Now, this is important that when you are entering from infratemporal fossa into the pterygopalatine fossa, you are passing through a gap between the posterior border of maxilla and anterior border of the lateral pterygoid plate. Now, this is the area where we are talking about. Now, this area is known as the fissure, and this fissure is between the posterior side of maxilla and anterior side of the plate. That is why it is known as pterygomaxillary fissure. Clear? Through this fissure, you will find that the third part of maxillary artery will enter inside the pterygopalatine fossa. Now, posterior border. Now, when you will see the posterior border, this posterior border of the lateral plate is free. Now, we will move to the medial pterygoid plate. Now, this medial pterygoid plate is also having the 2 surfaces and 2 borders. Now, what are the 2 surfaces? Again, when you will see this plate, this surface is the lateral surface of the medial plate, and this will be the medial surface of medial plate. Clear? It is also having the two borders. Now one border is here, which is the posterior border, because this is the posterior view, and one border is the anterior side, that is the anterior border. So it is having the anterior and posterior two borders and medial and lateral two surfaces. So let's discuss these surfaces one by one. So first we'll talk about the lateral surface of medial plate. So this is the lateral surface of medial plate. Now what is the name of this fossa? I just told you, this is the pterygoid fossa. So this pterygoid fossa, one-sided, bounded by the inner surface of lateral plate, and another side it is bounded by the medial plate. So it forms the one of the wall of pterygoid fossa, and it is related with the tensor palatini muscle, or it is also known as tensor veli palatini. So this is an important thing, that this surface, which surface? Lateral surface of medial pterygoid plate. So this lateral surface of medial pterygoid plate is related with which muscle? Answer is tensor veli palatini or tensor palatini. Now we'll move to the medial surface of medial pterygoid plate. Now this is the medial surface of the medial pterygoid plate. Dear students, when you will see the nasal cavity, now from the posterior side, when you are seeing the norma basalis, and if you will see the nasal cavity from the posterior side, the first bone which will come here is the medial surface of medial pterygoid plate. Anterior to this, you will find the perpendicular plate of your palatine bone. Clear? So this is the important thing, is that it is going to form the lateral wall of posterior nasal aperture. So this is the nasal aperture, that means the openings, posterior openings. Midline you will have the vomer bone, and on the side you will have most posteriorly the inner surface of medial pterygoid plates. Now these surfaces are covered by the mucoperiosteum. So the nasal mucosa will come up to this posterior margin of your plate. So this whole area is covered by the mucosa. So there are two plates. What are these two plates? Lateral plate and medial plate. Lateral plate is having lateral surface and medial surface. Medial plate is having lateral surface and medial surface. So on these four surfaces, what are the structure? If somebody will ask you, then lateral surface of lateral plate, you will have lateral pterygoid. Medial surface of lateral plate, you will have medial pterygoid. Then you will have the lateral surface of medial plate, which is related with tensor veli palati, and medial surface of medial plate is contributing in the posterior most part of the nasal wall, and it is covered by the mucoperiosteum. Clear? Now its upper part. Now when you will move to the upper part of this, it is having a projection. Now this projections on both the side are known as vaginal processes. They are known as vaginal processes. So when you will trace this medial wall and you will go towards the base of the skull, you will find that there is a curvature, and this point or this margin or this projection is known as vaginal process. Now there is a groove is present on the anterior part, and it is complete by the sphenoidal process of palatine bone. And when there is articulation occurs between the sphenoidal process of palatine bone, then it is known as palatovaginal canal, or it is also known as pharyngeal canal. So what is palatovaginal canal? Palatovaginal canal is a very fine area between the two bones. Now what are the name of these two bones? Vaginal processes of sphenoid bone. What is that? Vaginal process of sphenoid bone. That's why the word comes is the vaginal, and palato comes from palatine bone. So that is the sphenoidal process of palatine bone, and that's why you will have the palatovaginal canal, and this canal is also known as pharyngeal canal because it allows passage to the pharyngeal branch of your maxillary artery. Clear? Now there is a one more canal is known as vomerovaginal canal. Now this vomerovaginal canal is formed between the vaginal process again, but here the another bone is vomer bone. Clear? Here the bone is palatine bone, here the bone is vomer bone, but the process is the same. So when there is a formation of a canal between the vaginal process and palatine bone, then it is known as palatovaginal canal. and when it is between the vomer bone and vaginal process, then it is known as vomerovaginal canal. Now dear students, there is one more important difference, that this vomerovaginal canal is not a constant finding. So sometimes this canal may be absent, or if it is present, then this canal allow the passage to the branches of the pharyngeal artery, and it is also having the branches of the plexus which are arising from the pterygopalatine ganglia. And both these nerve and vessels are going to supply our pharynx. Clear? But dear students, you have to keep this thing in mind, that the vaginal process of sphenoid, if articulating with the vomer, then it is vomerovaginal. If it is articulating with the sphenoid process of palatine, that palatovaginal, and both these canals are having the pharyngeal branches, but the vomerovaginal canal is not always present, sometimes it may be absent. So here in this video clip, you first find out the formation. So this is the base of skull, you are seeing the posterior nasal aperture. This is the sphenoid bone, these are the two palatine bones, and this is your vomer bone. Clear? Now when you will see the process, now this is the vaginal process. You can see the vaginal process. Now this vaginal process, there is a very small thin area is present here, which is known as a groove. Now when the vomer bone is going to articulate, when the vomer bone will articulate, this groove is converted into the canal. And what is the name of this canal? Vomerovaginal canal. So vomerovaginal canal is present on the sides of the ala of vomer bone, and they are articulating with your which part? Vaginal process. Now we will move to see the palatovaginal canal. For that, we have to remove the all bones on this face. So we have removed the bones. Now here you can see that this is your palatine bone. What is that? This is your palatine bone. Now this palatine bone is having a projection is known as sphenoidal process. What is that? Sphenoidal process. Now this sphenoidal process is going to make a joint. Now see, try to look it carefully. This is the sphenoidal process. This is your vaginal process. This is the vaginal process. This is the sphenoidal process. And here between them you will see there is a small area where the artery was present. Clear? Now this area where the artery is present is known as the area of palatovaginal canal. So this is the area of palatovaginal canal. Then the artery is entering into the vomerovaginal canal, and then it is supplying the pharynx. But suppose this canal is absent, then the artery will directly supply the pharynx, because this is the posterior margin of the hard palate. Now behind that what will come? But obviously the pharynx will start in this area. So the important thing is that there is a confusion that it carries the blood vessel from posterior to anterior. No, the contents are coming from anterior to posterior. Please keep this thing in mind, that contents are coming from anterior to posterior in this canal. Because this maxillary artery is entering into the pterygopalatine fossa, then it is giving the branch, which branch is going posteriorly. So this pharyngeal branch is having a posterior course, not the anterior course. And in this backward course, it is first passing through this gap. This gap is known as palatino-vaginal canal, and then it enters into the vomerovaginal canal. Clear? So this is what is about the formation of these two canals. Now, so what are the contents? So it transmits the pharyngeal branch of the maxillary artery and the pharyngeal branches of pterygopalatine ganglia. And this vomerovaginal canal, I told you that its presence is not always constant. So if it is present, then it transmits either the pharyngeal branches or the branches of this pharyngeal branch. Clear? Now, what is about the borders of the medial plate? Now, medial plate is also having anterior-posterior border. The anterior border articulate with the posterior border of perpendicular plate of palatine bone, which we have just seen. That here what will happen? This perpendicular plate will come here, and that is the formation of the joint. But when you will see the posterior border of the medial plate is having four very important anatomical landmarks. What are these? Scaphoid fossa, then pterygoid hamulus, processus tubarius, and pterygoid tubercle. These are the 4 bony landmarks along with the posterior border. So what are these? Now here, if you will see, this is the medial plate, this is the lateral plate, but this is the anterior view. We are talking about the posterior border, so this is the posterior border of your medial pterygoid plate. So when you will see the posterior border, you will find that this posterior border of medial plate, when going towards the body, it will show a split. And this split in the upper part enclose a depression is known as scaphoid fossa. So here, this is the medial plate and this is the posterior border. It is going up and here it is splitting here. Now this is splitting and closing a depression, and this depression is known as scaphoid fossa. This scaphoid fossa is one of the area which give rise to the origin of tensor palati or tensor veli palati. So tensor palati or tensor veli palati is related with this area which is known as scaphoid fossa. Then what is the next is pterygoid hamulus. Now when we will track the posterior border, there is a tip. Now this tip which is visible here is known as hamulus. Now this is a tip on both the side. Now this tip is having a very important role, and that is in changing the direction of the tendon of tensor veli palati. So here you can see that this tendon of tensor veli palati winds around this process. So this is a vertical muscle which is going downward, but after taking a turn, aponeurosis will become horizontal, which is going to form palatine aponeurosis. So this turn is possible because of this projection which is known as pterygoid hamulus. So this is a question of your exam, that which muscle turn around the hamulus. Answer is tensor veli palati or tensor palati. Now apart from that, this tip will give attachment to a connection which is going to the mandible, which is known as pterygomandibular raphe. So this pterygomandibular raphe, upper end is attached to the hamulus, lower end attached on the inner side of the mandible behind the third molar. Now this is giving origin to the superior constrictor. This raphe is giving origin to the superior constrictor. Along with the raphe, the superior constrictor fibers also arises from the hamulus. So it is giving origin to the some fibers of the constrictor, and it is giving attachment to the upper end of pterygomandibular raphe. So there are 3 importance of the hamulus. First, it will provide to change the direction of the tensor palati. Second, it will give attachment to the upper end of pterygomandibular raphe, and third, it will provide origin to some fibers of superior constrictors. Now we will move to the third landmark of the posterior border, processus tuberis. Now what is processus tuberis? It is an angular process projecting from the middle of the posterior border. Now here you can see that this is the posterior border on which you will find this small angular projection. Now there is a one word is coming, tubarius. Now why this tubarius word is using? Because this is related with the tube. Now which tube is there? Answer is auditory tube or eustachian tube. Now you know that eustachian tube medially is having the cartilaginous part. So what will happen, that the cartilaginous part is coming here, and that part is supported by this projection. That's why, or this process, that's why it is known as processus tubarius. So what is processus tubarius? Processus tubarius is a small projection on the posterior border of the medial pterygoid plate, and this projection actually providing support to the auditory tube. Which end? Medial end. Which part? Cartilaginous part. Clear? And above this you will have a notch, and this notch accommodates the auditory tube. So this process and the notch supports the medial end of the cartilaginous part of auditory tube. Clear? So the next bony landmark on the posterior border is pterygoid tubercle. Now what is pterygoid tubercle? How to locate the pterygoid tubercle? So you can have the 3 important landmarks through which you can find out the tubercle. The first thing is that it is posterior most part of the vaginal processes of sphenoid bone, which is posterior-superior to the scaphoid fossa and inferior to the posterior opening of pterygoid canal. So Here you can see that this is the opening of pterygoid canal. Just below that, and this is your scaphoid fossa, you will find this is the posterior area of your vaginal process, and this point is known as pterygoid tubercle. Now, what is the importance of pterygoid tubercle? Pterygoid tubercle give attachment to a fascia is known as pharyngobasilar fascia. What is that? Pharyngobasilar fascia. What is pharyngobasilar fascia? When you will see the pharynx, the uppermost muscle is superior constrictor. Now, there is a gap between the superior constrictor and base of skull. That gap is filled by the pharyngobasilar fascia, and anteriorly the pharyngobasilar fascia attached on this tubercle of pterygoid area. Clear? So, at the end of this session, now you are able to understand the features about the lacer wing of the sphenoid and the pterygoid processes of the sphenoid. Clear? So, I hope by the end of these all 4 sessions, you will have the basic idea about the sphenoid bone, and when you will go for the viva, whenever you will have the whole skull in your hand, now the things will become more easy for you. So, this is all for the session. Thank you.